Welcome to another deep dive. You know, um, Today we're going to explore something pretty profound, the human side of healthcare.
Okay.
And we're going to be diving into a blog post
Right.
from a hospice nurse. And get this, the title is, "We Are All Just Walking Each Other Home."
Oh, wow.
Now, that title,
Yeah.
it really struck a chord with me.
Mm.
It suggests a different way of looking at healthcare, you know,
Right.
beyond the medical charts and the procedures and all that.
It really is a powerful phrase, isn't it? It speaks to, I think, the shared experience of both patients and caregivers and how they kind of navigate that healthcare journey together,
Exactly.
particularly as someone approaches the end of life.
Yeah, and that's where this hospice nurse's perspective, I think, becomes so valuable.
Right. Yeah.
The blog post is from a website of a company called Shift Fuel.
Okay.
They actually sell coffee to healthcare professionals.
Interesting.
But the author's personal experiences in hospice care really bring this idea of walking each other home to life. So how does hospice care shift the focus from simply treating illnesses to caring for the whole person?
Well, in hospice care, you're not just focused on prolonging life. You're focused on ensuring the patient's comfort and dignity.
Mm.
It's about recognizing that death is a natural part of life,
Yeah.
and that the final journey can be made with grace and peace.
And the blog post really emphasizes that healthcare in general should be about more than just treating symptoms.
Right.
It highlights the importance of human connection,
Hmm.
of being present with someone in their most vulnerable moments.
Absolutely.
What are some of the ways hospice nurses specifically do that?
Well, they focus on active listening, providing emotional support, and simply being there for the patient and their loved ones.
Yeah.
They recognize that sometimes the most powerful medicine isn't a pill or a procedure.
Right.
It's a hand to hold a listening ear or a comforting presence.
The blog post has this one incredibly moving passage where the author describes holding hands during final breaths and witnessing the unspoken communication of love. It's clear that this kind of emotional presence requires a special kind of strength and empathy.
Absolutely. Hospice nurses develop a deep understanding of the emotional and spiritual needs of their patients.
Mm-hmm.
They become adept at reading nonverbal cues and offering comfort in ways that go beyond the purely clinical.
But the author also acknowledges that maintaining this human-centric approach isn't always easy,
Right.
especially within the demands of the healthcare system.
Of course.
There's the pressure of documentation, time constraints, and systemic obstacles that can sometimes make it feel like caregivers are just going through the motions instead of truly connecting with patients.
Yeah.
How do hospice nurses specifically navigate these challenges, given the already emotionally charged nature of their work?
That's a great question, and it's something the blog post touches on as well.
Okay.
Hospice nurses often rely on strong teamwork and support networks.
Mhm.
They prioritize self-care and create boundaries to prevent burnout. They also advocate for their patients' needs and work to create a more compassionate and humane healthcare environment.
So even though the blog post comes from the perspective of a hospice nurse,
Hmm.
this idea of walking each other home clearly has implications for healthcare as a whole, wouldn't you say?
Absolutely. It's a reminder that no matter what area of healthcare we're talking about, the human element should always be at the forefront.
Yeah.
Whether you're an emergency room doctor, a primary care physician, or a mental health professional, the ability to connect with your patients on a human level is crucial.
That's an interesting point. So
Yeah.
how does this walking each other home concept play out in other areas of healthcare that might not be as focused on end-of-life care? Let's
Yeah.
explore that a little further, shall we?
Sure. It's fascinating to consider how this idea, born out of hospice care,
Yeah.
can be applied to other areas of healthcare.
Right.
Take emergency medicine, for example.
Okay, yeah, that's a high-pressure environment.
Right.
How does walking each other home fit in there?
Well, think about it. Someone arrives in the ER, scared, perhaps in pain, facing the unknown.
Right.
A doctor who embodies this philosophy doesn't just see a set of symptoms,
Right.
they see a human being in a vulnerable moment.
Yeah.
Taking a few extra seconds to explain what's happening, to offer reassurance, to make eye contact,
Mm-hmm.
those actions can have a profound impact.
So even amidst the chaos and urgency,
Yeah.
there's still room for that human touch.
Absolutely.
It's not just about stabilizing the patient physically, but also emotionally.
Exactly. And what about primary care?
Oh, yeah.
You're building a relationship with patients over time.
That's a great point. It makes me think of those doctors who actually remember details about your life outside of your medical history.
Mm-hmm.
They ask about your family, your hobbies,
Right.
things that show that they see you as a whole person.
It's about recognizing that health is influenced by so much more than just biology.
Right.
Social connections, emotional well-being, life circumstances.
Yeah.
All of these play a role.
Yeah.
A primary care physician who walks alongside their patient takes the time to understand these factors and how they might be impacting their health.
And what about mental health care?
Oh, absolutely.
That seems like an area where this idea of walking alongside someone is particularly relevant.
Absolutely. In mental health, the therapeutic relationship is paramount.
Yeah.
It's built on trust, empathy, and a shared understanding of the journey. A therapist who embodies this philosophy
Yeah.
doesn't just diagnose and prescribe.
Right.
They walk alongside their patient, helping them navigate the complexities of their mental health and supporting them as they work towards healing and recovery.
This is making me realize that walking each other home can even be applied to the interactions between healthcare professionals themselves.
Oh, yeah.
Think about nurses and doctors collaborating on a challenging case, or colleagues supporting each other through burnout and stress.
That's a crucial point and one that often gets overlooked.
Right.
The healthcare system itself can be incredibly demanding, and it's essential for those within it to support one another.
Yeah.
Creating a culture of compassion and understanding within healthcare teams is vital for both patient care and the well-being of the providers.
So how can we move from this insightful concept to actual change within healthcare?
Right.
It's easy to talk about being more human-centered, but actually implementing that shift seems like a massive undertaking.
You're right. It's not a simple fix.
Yeah.
But there are things we can do both individually and systemically.
Yeah.
Individually, we can start by examining our own biases,
Mm-hmm.
our assumptions about patients and how we communicate.
That self-reflection is so important.
Yeah.
It's about asking ourselves, am I truly listening to my patients?
Right.
Am I seeing them as individuals or just a collection of symptoms?
Mm-hmm.
Am I treating my colleagues with the same compassion and respect I offer to patients?
Yeah, these are powerful questions.
Yeah.
And on a systemic level, we need to address the pressures and constraints that hinder human-centered care. We need to reevaluate how we train healthcare professionals, how we structure healthcare systems, and how we incentivize providers.
I'm starting to see that walking each other home isn't just a nice sentiment.
Yeah,
It's a call to action.
right.
It's about recognizing that healthcare is about much more than just treating diseases.
Absolutely.
It's about caring for people, supporting them through challenging times, and honoring their inherent dignity.
It is.
But it's a two-way street, right?
It is.
It's not just about providers offering compassion. It's also about patients engaging actively in their own care and communicating openly with their healthcare team.
Absolutely. It's a partnership,
Yeah.
a shared journey towards well-being.
Okay, so we've talked a lot about healthcare professionals. But how can we as patients, or simply as individuals, embody this walking each other home philosophy in our daily lives, even outside the context of healthcare?
Right.
That's a question I'm really grappling with. You know, it's
Yeah.
interesting, isn't it? This concept of walking each other home.
Yeah.
It started with a blog post about hospice care.
Yeah. It's really resonating with me on a much broader level.
Uh-huh.
It makes me think about how I interact with everyone in my life.
Right.
Not just doctors and nurses, you know?
That's the beauty of these deep dives, you know?
Yeah.
You start with a specific piece of source material,
Right.
but the insights often ripple outwards, touching upon these universal human experiences.
So how do we translate this profound idea into action in our everyday lives?
Yeah.
What does it look like to walk each other home outside of a healthcare setting?
Well, it's about shifting our perspective, I think.
Okay.
Instead of seeing the people around us as strangers
Right.
or simply individuals going about their day, we can start to view them as fellow travelers.
Yeah.
On this journey we call life, we all have our burdens, our joys, our hopes and fears.
Yeah.
Recognizing that shared humanity, I think, is the first step.
And once we acknowledge that interconnectedness,
Yeah.
how do we then act upon it?
It doesn't require grand gestures.
Sometimes the most meaningful acts of walking each other home are the smallest ones.
Right.
A genuine smile to the cashier at the grocery store, offering to help an elderly neighbor with their groceries,
Yeah.
truly listening to a friend who's going through a difficult time.
Right.
These are all ways of extending ourselves,
Yeah.
of acknowledging the other person's humanity and offering a moment of support.
It's about being present, isn't it?
It is.
Putting down our phones, making eye contact,
Mm-hmm.
really listening to what people are saying, even if it's just for a few minutes.
Presence is such a powerful gift.
It really is.
In a world that's constantly vying for our attention,
Yeah,
offering someone our undivided attention can be incredibly meaningful.
absolutely.
It's a way of saying, I see you, I hear you, and I'm here with you in this moment.
This makes me think about the phrase walking each other home itself.
Yeah.
It evokes this sense of companionship,
Right.
of journeying together.
Yeah.
It's not about leading or following, but about walking side by side, offering support and encouragement along the way.
Exactly. And sometimes it's about simply bearing witness to another person's experience,
Oh, yeah.
holding space for their joy or their sorrow without judgment or the need to fix anything.
Mm.
It's about recognizing that we all have the capacity to offer comfort and support simply by being present with one another.
This has been such an eye-opening deep dive for me.
Yeah.
What started as a blog post about hospice care
Right.
has evolved into a much broader reflection on the power of human connection.
It has.
It's made me realize that walking each other home isn't just a philosophy, it's a way of life.
It is.
It's a choice we make in each interaction to acknowledge the humanity of those around us.
Absolutely.
And to extend ourselves with kindness, compassion, and presence.
And it's a journey we're all on together.
Thank you for joining us for this deep dive into the heart of human connection. We hope this conversation has inspired you to reflect on how you can embody this philosophy in your own life, to walk alongside others with empathy and understanding, and to create a world where we all feel a little less alone on our journeys.